And I'm going to propose that we can use those individual items as an informal, non-standardized way of measuring how the client does in relation to a particular activity that is your therapy goal. Response elaboration training has quite a bit of evidence-based support. It has been described as a type of loose training. The idea behind it is to improve lexical retrieval and the number of content words produced by an individual with aphasia. So it's a conversational based treatment. The learning technique is forward chaining. That refers to taking the client's response and helping facilitating elaboration, so the client is building on his or her own responses and learning to elaborate the responses. So initial evidence showed that response elaboration training is an effective intervention program for improving verbal production in conversation and for generalization of improved skills across types of aphasia. So this is a great one to know if you don't already know it, because it is appropriate for different types of aphasia, as well as for people who have aphasia and apraxia. But in order to really figure out what Alan will be able to do, I am suggesting that the first step in our clinical process needs to be determining the client's priorities. And I'm going to give you right now 3 tools that you can use to help determine the client's priorities. There are other ways of doing it, but these are 3 that I think are relatively easy to use and can be appropriate for aphasia, but also for the other clients on your caseload who may have other kinds of communication issues. So, most therapies rarely generalize to untrained items. That means that training a variety of items may not make any meaningful difference in your client's daily functioning, especially when you have a short amount of therapy time. Maybe if you had 2 years of therapy time, that would be different. We don't have that anymore. So if we just take a big bunch of picture cards, even though you may perceive them to be functional items, if they're not directly relevant to the activity that the client wants to do, we're probably, especially in short-term therapy, not going to make the effect that we want to have. Typical standardized assessments, like something like the Boston Diagnostic Aphasia Exam, are designed to measure decontextualized skills. So the test stimuli themselves are trying to get an average performance, and they're manipulating the test stimuli based on perhaps word frequency in the language, familiarity, maybe personal relevance, more like general familiarity, or in other factors. But those are not the factors that are necessarily most important for us to think about functional therapy goals and the course of treatment.